Hello everyone, this is Dr. Raj Kapadia, Consultant Surgical Oncologist at Fortis Hospitals, Mulund. Today we are going to talk about breast cancer in younger females. As we all know, the incidence of breast cancer is going up in the country, especially in younger females. The cancer in younger females does behave a little more aggressively compared to the older females, and it is commonly associated with the BRCA gene mutation. So it's very important that when the patient comes or someone has a breast lump, we take a proper detailed history of the genetic issues in the family, and if there is a likelihood of a history of breast cancer in the family, the BRCA gene needs to be tested. If it is not genetic, then we need to the first step is to do a biopsy and do a ER/PR HER2 receptor test on the tumor, because this is a very important marker test which guides our treatment, whether to give chemotherapy first or do the surgery first, depending on the stage of the disease. So the breast cancers do behave aggressively in younger females. What we need is a correct investigations to stage the disease, a biopsy to suggest the histology and the type of disease based on the receptor tests, and then to guide our treatment according to the patient. Every patient is different, especially in the younger age group. We need to treat the patient as an individual, as a whole, and not the disease only. For this, a detailed history and the staging workup, which is important, it's to be done, and then the treatment, depending on the exact and the final stage, we can do in a combination of surgery, chemotherapy, and radiotherapy. Since in the younger females there is always an issue of how the reconstruction will be done or not done. Breast conservation is equally safe in the younger females as well. Both doing a mastectomy or a breast conservation surgery are equally safe and can be opted as per individual personal choices. The reconstruction also these days can be done simultaneously with the surgery, so that a delay in the reconstruction is avoided, and it actually does not delay any of our further adjuvant therapies like the chemotherapy or radiation. It's perfectly safe, and we can actually go ahead with a simultaneous reconstruction in case it is necessary, so that we can give the best outcomes in terms of cosmesis as well as oncological outcomes not being compromised. Thank you.